Welcome to the Medical Ancillary Sales Podcast, your number one source for making money in the medical ancillary sector. Mike and Viv bring you the latest information from lab services, pharmacy, diagnostic testing, and so much more. The latest in ancillary services will be right around the corner. Welcoming the hosts of the Medical Ancillary Sales Podcast, here's Mike and Viv.
Hello and welcome to the Medical Ancillary Sales Podcast. I'm your host, Michael Berg, and joined by Viv Hudson. Viv, this is the last. No, this isn't the last one you're going to be doing from Down Under. This is the third to last one, I guess. You still got another week there.
Yeah, I've still got a couple more chances to get to the beach before I head back.
You haven't been there yet, huh? Is it nice and hot there?
I haven't been in the water, but I've been a couple of times to cafes by the sea and driven along it. So yeah, it's beautiful.
Yeah, I'll bet. Would love to go there. So Viv, today I wanted to talk about a test that is an add-on test to technology that we already offer, and that's the PCR technology, which is exploding in popularity. We've already done several podcasts on the importance of the GI and respiratory panels and how useful they are during cold and flu season. But what we're finding is that there are more and more applications for this PCR technology. And today we wanted to talk about a panel that we call it the Vaginosis panel, although it covers more than just vaginosis. So, Viv, what do you know about this panel? How does this differ from the traditional method of diagnosing vaginosis?
Well, I know, for a doctor, it can be a little bit hit and miss as far as diagnosing these sorts of conditions. And as with the respiratory and the GI panel, if they're taking a culture, they've got to let it grow over several days to be able to diagnose things. So with this new panel, it's looking at more the DNA or the RNA of the actual pathogen. So it enables the lab to give the doctor a definitive diagnosis within a matter of hours of them receiving the sample at the lab. And then the doctor can order the appropriate treatment. And I can't remember how many pathogens
33.
This one tests.
33.
33. There you go.
33 pathogens. And you mentioned growing a culture as being the traditional method for a diagnosis. But the inherent risk in that, not only is it not accurate, it's a high degree of cross-contamination is pretty prevalent. And so you can get some false reads on it. But you would have to grow a culture essentially for each pathogen that you want to identify. Yeah. You're more the science person than me. You get the pharmacy degree.
Yeah, and also I know, particularly with vaginal symptoms, they can be either non-existent, so people don't even know that they have a problem, or they can be very similar. So it can be very easy, like candida. If you've got the traditional clumping kind of cottage cheese look, if we can go into details, I mean, you can kind of say, well, that's going to be thrush, but it doesn't always present. Not all the vaginal infections that occur can have such distinctive symptoms. So it's very difficult to determine from one particular infection to another what it actually is. So this particular test, I think, is going to be quite groundbreaking in being able to clear up a lot of that mystery.
Yeah. So well, not only do you have patients that can potentially be asymptomatic, but you could have patients with symptoms that are similar, but for completely different pathogens that are affecting them. They could have the same symptoms, and I mean, we've talked about that before with the upper respiratory and GI, but we could run back through it. I mean, there's some obvious flaws with some obvious inherent risks in diagnosing the wrong thing. I mean, you not only do you, I'm sorry, go ahead if you were. From
Yeah,
your
no,
pharmacy
it's
background, give us from your
yeah.
pharmacy perspective as a pharmacist. I mean, there's some obvious risks there.
Well, absolutely, because I mean, if you don't diagnose it correctly and it doesn't get treated effectively, then there's that risk of that condition being spread for a start, or of just the person actually suffering for longer, or maybe just starting to think, well, maybe that's just the way I am now, rather than uh, understanding that they have a condition that is treatable.
Hmm.
So it's going to help a lot of people be a
Well, it
lot
also
clearer.
it saves the system money too in the long run. I mean, you have things like more severe conditions that these pathogens can lead to, endometriosis and different cancers and things like that, that could cost the system a lot more money than if it's treated effectively up front. And the best way to treat a patient is to have objective data that you know specifically which pathogen is afflicting that patient, so you know the correct course of treatment. Because too often we have the overuse of antibiotics. We've covered that many times. Everybody listening to this, I'm sure, knows the risks in overprescription of antibiotics. But also delaying treatment for that patient could lead to much more severe problems that could cost the system a lot more money, which is why we're seeing adoption with CMS, with even Medicaid is a great payer in most states for this test, because there's obvious long-term benefits to getting these patients treated up front. There's a really clumsy way of
Yeah,
saying it.
yeah, no, but absolutely, if it's not detected, it can move further up the reproductive tract and cause infertility and a whole bunch of other problems that can be potentially very life changing for people, and not in the way that they want it to change. So quick and effective diagnosis is just a no-brainer, really.
And does this go without saying, Viv, in your estimation, the targets for this test is just anyone doing women's health, I would think.
Absolutely, absolutely. So, I, I don't know about urgent care, how much they get into that kind of thing, but there is that potential. But family and internal medicine, and obviously your OBGYN market. I mean, they're the key targets.
Right, and they can also use the respiratory and GI panels as well. So this doesn't have to be sold as a standalone. In fact, this could be packaged up and sold as something that physicians can offer their patients for any of these symptoms, whether it be GI, respiratory, or in the women's health department. So
Yes, absolutely.
okay, if anybody has questions about it, please. I know this is new. This is new tech. This is not new technology, I should say. But the number of pathogens that this tests for and the availability is what separates this now. So we work pretty closely with Thermo Fisher Scientific, who makes the equipment to do the pathogen detection. And this is something that there are labs that have validated the test and are now offering this. We're partnered with those labs. So please get a hold of us if you guys have any questions about the test or would like to start offering it to your physicians. But I can tell you at Thermo, I know some of the higher ups there, and they are bracing themselves. They think that this is going to be an absolute game changer for them and in the women's health department.
Well, absolutely. I've just seen a statistic on it, and it estimates that 5 million women are infected each year in the United States with Trichomonas vaginalis. So when you think about that, that's, over 1% of the population, which is pretty significant. And that particular condition is also associated with an increased risk of getting the AIDS virus.
Oh,
So,
really?
it's, yeah,
We
yeah,
are
it's,
jumping all over the place here, but a couple things I forgot to touch on. We keep talking about vaginosis because that's probably the most practical clinical use, but you also have several sexually transmitted diseases, as well as bacteria that causes UTI. So this is not just a vaginosis panel, even though it's being referred to as a vaginosis panel. This is kind of a catch-all for several vaginal pathogens. And also the other thing I forgot to touch on, I know I'm going to get this question, so may as well tackle it now. The specimen collection for this is typically it's going to be a urine specimen, but it can also be tested through a thin prep or a swab. That's all I have, Viv.
Right. Well, I think that's about all we need. I mean, we just need to know that it's quick and accurate diagnosis and where your target market is. And, it's a pretty prevalent condition. So go out and sell it.
That's right. And we'll have some more data for you. And what we'll do is we'll interview people who actually know what they're talking about, guys. So if you're listening, we just wanted to get something out there because I know that there's a high demand for the test. And I know anybody that has inroads with OBGYNs especially, this is a home run, I'm telling you. You go in with this, you are going to get some business for sure, and you're going to get a high volume of business. So anyway, thank you, Viv.
Thanks, Mike.